It was last Friday afternoon when Christine Elliott, the Minister of Health, told us that there was a consideration, or probably more plainly, there would be restrictions on people who opted not to get a COVID vaccine, which of course is now rolling out slowly across the country. The first 250,000 doses expected in the next 10 days or so. And there's been a lot of talk about what that means, and does it turn into something called an immunity passport? That seems to be the name that's been tagged onto it. We had a discussion the other day with a lawyer, a human resource professional, who told us employers probably wouldn't be able to enforce that on you, but there are some things that they can do. To continue the discussion, we turn to the Canadian Civil Liberties Association. Brenda McPhail is the Director of Privacy, Technology, and Surveillance at the Civil Liberties Association, joins us this afternoon. Good afternoon, Brenda.
Hello.
It's an interesting discussion because I guess in many ways we've never run into this kind of thing before. What's your first take on this?
Well, you're right. It's new, and it's something that we have to think through really carefully, because one thing we know, people make bad decisions and bad policy is created when we're afraid. And right now we're all afraid of what's going to happen with COVID, and also just so crazy anxious for the lockdowns to end and to get back to normal life, that we may be prone to making bad decisions. And I think the comment that Minister Elliott made, hopefully speculatively, was one of those, on the edge of being a really bad decision.
Well, I can tell you, because I did the interview, and I asked her if there would be restrictions on people, and it was a pretty solid yes, couched in some, terms that you could maybe wiggle out of down the road. But it certainly sounds like something that is being very, very, very heavily considered. But so why is it bad policy?
Well, when you think about health information, I think almost everybody agrees, is one of the most personal, sensitive pieces of information we have. An immunity certificate would essentially be the equivalent of saying, when somebody asks you, you have to share that personal information with them. Some people might say, okay, the idea sharing whether or not I had a needle doesn't feel very personal, but we have to think about the people for whom getting that vaccination is a serious risk. We already know from the trial in the UK that people with serious allergic conditions may not be able to at least take the Pfizer vaccine. It may be even more dangerous to their life than COVID. So there's going to be other cases where people who have disabilities, people who have underlying medical conditions, simply won't be able to take the vaccination. Are we going to ask them to say, I'm not vaccinated, but here's the proof of my incredibly personal medical condition in order for you to let me enter your store, come to your bar, attend this concert, acquire this public service, get in your cab? Is that the kind of society we want to live in?
But it doesn't have to be tremendously detailed, does it? Couldn't it just be a card that says, I've had the vaccine. No, I have a personal medical problem. Doesn't have to be detailed, does there?
So there's different theories on that. One of them actually is that this immunity certificate would end up being a digital tool. So that opens up a whole different kettle of fish when it comes to, what information might be collected and when it might be collected and who would get access to it. So that's one side of the puzzle. But even the idea, it's a radical idea in Canada that we would create a category of haves and have-nots based on a choice they make about a medical intervention. Just at the really fundamental level of, do we think it's appropriate that people's medical choices should dictate access to public services, is something that we need to take a pause and think about more carefully before we would move forward in this kind of model.
But there are situations already for people who want to work as a PSW or a healthcare aide in some provinces. They need to have proof of immunization. They need to have proof of a TB test. How is this different?
Well, the difference, it may or may not be different. That's part of the problem of this debate, is that we're speculating based on some idle comments in a press conference about how it might affect us down the road. Being clear that, there are no mandatory vaccination laws, right, first of all, and there are precedents. So, I have a vaccination card that shows when I had my shots. I'm not usually asked to show it, but, recently, or back in the good old days when it was allowed for international travel, I have, on occasion, had to show it. So it's not completely unprecedented, the idea that kind of proof would have to be provided. But it is a shift in thinking about the way that we would behave to speculate that it might be not just for something like a frontline service provider who works with incredibly vulnerable populations, where we have some experience now, and maybe you need to show it to get into the cinema, which was one of the examples the minister provided. So again, it's not entirely that it's a completely unheard of or even completely unreasonable concept that there are places where it would be necessary to show that you've been vaccinated. What's different is the idea that there might be sort of a widespread ability for a huge range of organizations and services to ask for this, and for people to have to supply it or be excluded from public life.
And it seems to me that there's a line, I almost see it being drawn here, between a bit of public sector and a bit of private sector, because I think maybe, as you just mentioned, Brenda, if we want to visit inside a long-term care center, that might be something that makes sense, having to prove that you've had a vaccine. But when we move into the private sector, that becomes a little different. And then I start to think about another part of the public sector, which is municipalities. If they wanted to put that kind of thing in place to say, look, you can not go into an arena unless you've had a vaccination. I realize it's all speculative at this point, but that is all speculation I've heard, not just from people speculating, but from government officials. Is there a line between the private and the public sector?
There's a really important line, and one of the concerns about this speculation is sort of the beginning of creating the shared possibility of the idea that it might even be okay for private sector organizations to demand this. And to be clear, in the absence of any legal requirements, there's no mandatory vaccination laws in Canada, and it's very unlikely there ever will be for constitutional reasons. So in the absence of any legal grounding, to speculate on allowing private sector businesses to decide whether a medical choice that people make excludes them from entering a business or receiving a product or a service, that's a really radical thing to be talking about in Canada. So we've got to be really careful about accepting the "of course there will be restrictions" tone that came out in that press conference and that some people are pushing, because it shouldn't be "of course." It should be, really? How have you thought about this? What are the risks? Who is going to be discriminated against? We know that people who are doing frontline jobs are disproportionately people of color. They're disproportionately newcomers to Canada. They're disproportionately women. These are groups that, often have less power in our society. Are we going to let private sector organizations that already have a great deal of control over them also dictate their medical choices? Is that how we behave in a democracy?
I have seen, Brenda, and maybe you've seen it as well, people who have said the old sign that we see on businesses, no shirt, no shoes, no service, add no vaccine to that. It's exactly the same. How's that different?
So there are personal risks to individuals from being forced to share health information that are different than the risks that they face when they don't want to put on a pair of shoes. So it's not, I think we need to be careful of conflating sharing of personal information with something as simple as wearing a pair of flip-flops to go into the corner store, first of all. The other thing is we've got to be careful that we're not making policies that aren't grounded in evidence or science. And an important point here is that we don't even know if vaccination is actually going to stop us from being infectious. We know that the vaccination will help protect us as individuals from being infected, but it's not even clear whether it will also stop us from being infectious. So putting restrictions on people in that complete dearth of evidence adds another layer of problem to the whole equation.
And just to be clear, Brenda, if a business were to say, if you don't have a vaccine, you can't come in here, do they have that right as a business owner?
That's the kind of question that we need to be thinking about and diving into. And, businesses don't have the right to discriminate against people, so they certainly wouldn't be able to exclude people who, for various reasons, have valid medical conditions that prevent them from being vaccinated. Whether or not they would have the right to decide who comes into their business in relation to a choice, if getting the vaccination is genuinely a choice that's not dictated by an underlying medical condition. I think that's something that we need to think through a lot more carefully. Private businesses do have the right to set conditions for entry into their premises, but they don't have the right to do it in a way that's discriminatory, and particularly for businesses like grocery stores, which would be an essential service. I think there are really important social questions around the extent to which it would be reasonable to allow a business to make a decision about who gets to eat and who doesn't, who gets to access food and who doesn't.
Well, but we do see that right now where businesses are putting up a sign that says, if you're not wearing a mask, we don't want you to come in. Is it just that hasn't been challenged?
Oh, I think that's been challenged in lots of different places and in different ways. Certainly, if not in the courts, in the court of public opinion. We've probably all seen the YouTube videos of people throwing tantrums because they want to go in without a mask and they're being told no. Again, there's a difference between a vaccination, something that goes into your body, and something that you wear on your body. And that sort of nuance needs to be considered as part of this equation.
It sounds like so many other legal things, Brenda, that there's an awful lot of gray area.
I think legally there are gray areas. I think that sort of socially and ethically what we need to focus on is, what kind of society do we want to live in? What does it mean to be safe? Do we want to be safe from the virus? Obviously. Do we want to be safe from excessive intrusion into our private lives? A lot of people would say yes. Do we want to be safe from other people? A lot of this is around, the dangers that others pose to us. That's a really dangerous way to start thinking about society, and I think we need to take a pause and have a moment of thinking, when this is over, what do we want our Canada to look like? The Canada that I want to live in doesn't rank people by being safe or unsafe, have or have nots, based on a decision about their health.
Brenda, thanks for your time today.
Thanks so much for having me.
Brenda McPhail from the Canadian Civil Liberties Association, speaking about the possibility of a immunization passport. Raises some interesting discussion points.